Hello everyone, welcome to Health for You by UBE Media. My name is Dr. Pranav Kumar. I am an orthopedic surgeon and I mostly do spine surgeries. I've been trained in England for spine surgeries and probably I am the only person in Indore who has been trained by neurosurgeons. Otherwise, normally orthopedicians are trained by the orthopedicians and the neurosurgeons by the neurosurgeons. There are lots of topics where there is lots of confusion as far as spine is concerned. Today we'll be talking about fractures of the spine. So if you understand about the spine and understand the way the spine works, you will understand that most of the spine fractures don't need any operation. So if you talk about the spine, if this is your spine, we divide the spine into three parts. So if I draw a line here, this is the front part. If I draw a line here, this is the middle part, and then you have the back part. So if you see, this is the front part, this is the middle part, this is the back part. And this is the concept where we work on. We see the concept of Dennis, this was originally given by Dennis, and he talks about the stability of the spine. So any fractures needs to be fixed or operated only when the spine stability is gone, is not there. You're not able, your spine is not able to support you, and it is causing damage to the nerve roots. Any spine fracture can be severe enough to warrant an operation, or most of the times it's mild. It could either be a ligament injury, it could be a muscle sprain which gets relieved on its own, or with muscle relaxants and painkillers. Now fractures can be either a fracture of this bone per se or a dislocation of the spine. So if you see, if my spine is here in a line, and if it is coming like this is a dislocation. And if you have a fracture of this bone, this will be called as a fracture. So this is the vertebra and this is the disc in between. So if you have a fracture of this bone. So if you see, these are all solid bones. So unlike other bones of the femur, the thigh bone, the hand bones, it does not separate. It just gets compressed like a swash. If you press on a dough, it will swash itself. It won't separate out. So that's what happens in the spine. The most important thing in spine is it protects the spine, the nerve roots and the spinal cord, and it gives the stability to your back. If any of these two things are countermanded, then you need an operation or some kind of help to help the fractures heal. The causes are most commonly it's because of the accidents. It could be because of a fall from height. It could be because of a sports injury or any quarrel or violence. Now, it is important to understand the mechanism of injury is very important when we understand a fracture. If you have a significant fall and you have a significant injury, then chances are that the fractures will also be significant. But if there is a fracture without any significant trauma, then you need to be more worried, because then the reason is the bones are very weak, either because of osteoporosis or because of any pathology like infection, tumors or cancers. So then you need to be worried more than a fracture which has happened because of a significant trauma. And most of the times, 80% of the times, it's the young people who have a spine fracture. And if you understand that young people have all their life to deal with. So over a period of time, if you don't have the proper alignment of the spine, it will lead to what is called as compression of the spinal cord. And this will lead to weakness or radicular symptoms or permanent damage to the spinal cord. So that's the reason you have to understand that understanding fractures of the spine is important. Now, if you talk about diagnosis, it's most of the times either an X-ray, CT or an MRI which will give you a conclusive diagnosis. Clinically, you can feel that pain in the spine, you can press on the spine and feel the tenderness, but it's mainly the x-rays and the MRI. So you need to visit a doctor if you have severe pain or significant persistent pain in the back after an injury. What can be done for it? Most of the times you don't need any kind of treatment, because most of them are either ligamentous injuries or muscle spasm. Sometimes you may need a brace which will helps the spine to maintain its alignment. It will immobilize the spine and prevent the pain, and importantly, pain control in a long term, because you can't give pain medications for a prolonged period of time. If you talk about the treatment of fractures, most of the times it's braces or muscle relaxants and painkillers, and most of them don't need surgery because the stable spine is stable enough to bear the weight of your body, and it's not causing compression on the spinal cord or the nerve roots. Braces work in three mechanisms. It will help the spine to maintain its alignment, it will immobilize the spine, and it will give pain relief. Those are the main reasons we use braces, and most of the times we end up having braces for good 3 to 4 months. Compromised, or there is compression on the nerve roots which is causing damage to the uh, which is causing weakness in the legs, then you end up having an operation to maintain the alignment and decompress the nerve roots which is getting crushed. So most of the times it involves putting screws into the vertebral body and rods to stabilize it, and then decompressing the compression which is there. And most of them, if there is no weakness, do well. The problem is if there is permanent damage to the spinal cord, then most of them don't improve. There are chances of improvement, but the chances are negligible. So we need to understand that we need to protect ourselves when we are driving, and we need to protect ourselves when we are working at a height or doing something at a height, or we are involved in some kind of altercation when we have to take care of our back also. Hope you have gained out of the talks, and for more such videos, like, share and subscribe to our channel.